Hi, my name is Rustam Nabiev and I'm the director of Shifo Foundation. In this presentation, I'll tell you more about Shifo and what we are doing to make sure every child receives preventive health services, no matter where they live. We started Shifo to ensure that children are fully immunized, no matter where they live. At Shifo, we have three values: transparency, local ownership, and taking the road less traveled. The first value, which is transparency, means that solutions that we bring should improve transparency in low-resource settings, and that we report to our donors how their funds have been utilized and what short and long-term impact it is making. The second value is the local ownership, which means that solutions we develop have to be based on the local context and resonate with local partners. Local partners should own and drive the processes, which is an important part of achieving sustainability. The third value is taking the road less traveled. We know that to solve some of the world's toughest challenges, one has to go beyond conventional solutions and think outside of the box. At Shifo, we want to take the road less traveled in order to make a long-term impact. There are many people and organizations who are working to ensure every child is fully immunized. It is a chain that consists of health workers, families and communities, and decision makers who ensure that health workers have all the resources and supplies to do their best work. Each one of these stakeholders bring value. That's why we call this a value chain. This chain has to be strong, and they need relevant and up-to-date information on the situation on the ground which can guide their work. Each one of these stakeholders needs information to do the right actions. Even though today we have reached quite a substantial progress in making sure children receive preventive health services, but yet today 1 in 5 children are still going under-vaccinated, which results in about 1.5 million children dying every year. At Shifo, we believe there are 3 major challenges that are stopping us from strengthening this value chain and to reach every child with life-saving vaccines. Problem number 1 is that today half of children living in the world are not registered, so we don't know who they are and where they live. The second problem is that the health workers are not using the proper tools and methods to follow up on every child's vaccination plans. And the third problem is that few decision makers have timely and relevant information on what's happening right now in different clinics, health centers, villages, and where to prioritize actions. Shifo team has been working to understand 3 problems in details and how to solve them. The team has a background from working in some of the world-renowned institutions such as Karolinska Institutet, Karolinska University Hospital, and the Royal Institute of Technology. We developed MyChild system to help solving these 3 major challenges. MyChild system enables 3 things: to register newborns and children that come to receive their vaccinations in health clinics or during outreaches, to help health workers in follow-up of every child's vaccination plan and other preventive health services, and to give decision makers timely and relevant information to help guide their actions. MyChild system works on any laptops or Android smartphones, and it works both offline as well as online, which is very important in the settings where internet connectivity is an issue in general. Even though we developed MyChild system to strengthen the entire value chain, we considered the nurse to be the most important end user for MyChild system. At Shifo, we consider the frontline health workers to be the most important change makers in ensuring that every child is fully immunized. They are our heroes, working every day and do their best in given conditions. For us, nurses are change makers and we want to make them feel stronger. We work with nurses every day to understand them better, to know what they need and what they want, to understand what makes them come to work every day and do their best. Winning the hearts of each and every nurse is important for us. At Shifo, we know what they want. We know what they want and we're delivering on that. We understood that 3 things make nurses feel stronger. Number 1, job satisfaction. Nurses should use tools that help to do their job better, and they should work in an environment that makes children safe and comfortable. By using MyChild system, the nurse eliminates all the administrative work to fill in and report on statistics. The nurse knows the history of a child, and the nurse knows which children needs to be followed up so she can be proactive in her work. The second point that makes nurses feel stronger is continuous on-the-job learning. They like to learn new things and continuously develop their knowledge and skills. They need to grow in their professional career, and they need support with that. So at Shifo, we bring 4-level certification programs to ensure that nurses grow their knowledge and be able to make a change not only at the health center level, but also in their districts, nationally and internationally. The third thing that will make them stronger is the recognition. Nurses should be recognized for their achievements as individuals and as teams working to achieve on the goals. Perhaps you agree with me that everyone needs these 3 things in their own jobs: job satisfaction, continuous on-the-job learning, and recognition. We believe it is a universal need for human beings to perform better in our jobs. And at Shifo, we're focusing to bring these 3 things to nurses so that nurses feel stronger. Between January and May 2014, we have implemented My Child system in 16 health centers in Mukono district, Uganda. We have a history of working in Mukono district, Uganda since 2012, and we wanted to learn, together with the district leadership, how to properly implement and sustain My Child system. Initially, we piloted My Child system in 3 clinics and then scaled it to cover 16 public health centers in Mukono district. We provided 3-day training to nurses on computer literacy and how to use My Child system. As part of training sessions, we also let them know that they're change makers and our heroes. In this picture, you see Alicia, one of our heroes, who is using the system to register and follow up on children and educate parents on the importance of vaccinating their children. This is Annette, working in Mukono HC4. Recently, in October, Mukono HC4 was awarded as the best health center in Uganda for their exceptional health service delivery. And we worked with Mukono HC4 since 2012. We're very happy for their achievements. This picture shows outreach session. Outreaches are done in rural and hard-to-reach areas to those children who cannot otherwise come to the health centers. To ensure continuous operations, we built 3 structures in Mukono district. Number 1, technical support structure, to ensure that nurses can rely on My Child system to work all the time. Number 2, capacity building structure, to ensure nurses receive continuous on-the-job training. And number 3, monitoring and evaluation structure, to ensure data generated from My Child system is part of continuous quality improvement in Mukono district. Between January 2014 and December 8, 2014, already more than 13,522 children are registered and more than 3,664 children are fully immunized in Mukono district. We started working with district leadership and particularly with district health officer Dr. Eli Tumushabe on continuous improvement of child health indicators. My Child system generates monthly report on detailed indicators. Through this, different stakeholders will be able to know what is happening on the ground. The district is integrating data from My Child system in continuous quality improvement workshops, where progress is reviewed towards the goal, lessons learned are discussed, and new action plans are done per health center to better achieve their goals. At Shifo, we're committed to 100% transparency on how we utilize funds obtained from donors. We track every donation and provide donors with implementation and impact reports. These reports tell you about how the funds have been utilized and what short and long-term impact it is generating in the supported communities. We're very happy that in November 2014, Ashoka has recognized Shifo as the best Swedish social entrepreneurs. My Child system is a tool that supports the value chain who works to ensure that every child is fully immunized. The key to current and future success of My Child system are 3 things. Focus on nurses and bring them job satisfaction, continuous on-the-job learning, and recognition. At Shifo, we should win their hearts of each and every nurse. Establishing support structures is important, and here we should focus on technical support, capacity building, and monitoring and evaluation structures. This will ensure smooth functioning of the system in the district and the integration of the data for continuous quality improvement within the value chain. When I was visiting in Uganda in September 2014, Dr. Anthony Konde, health officer of Mukono town, told me this African proverb that summarizes what we're doing at Shifo. Strength of the chain lies in its smoothness. And at Shifo, we're bringing that smoothness to the value chain through My Child system. Thank you for listening and have a great day.